We're back on Born Before 64 with James E. Butler, DMD, and we're talking about my implant, and I have a question for you. What are those models that are sitting on the desk, and can you show me the mechanics of implants and
Sure.
actually see some pictures?
Absolutely.
All right, let's do it. Can you show me?
You know, commonly people come in and they don't actually know what an implant is.
Right.
Okay? So what people want is teeth.
Right. Right.
We don't want, you know, partials
Or
and things we take in and out. And we don't
Right.
want bridges that are going to fail and ruin the rest of our teeth.
Right.
So what we want is teeth, okay? How do we get teeth? Well, the good Lord made them with roots, so we had to invent roots
Right.
that we can put back in your jaw.
Right.
And remember the implantologist's secret. If I'm going where there used to be a tooth, the body really likes having that in there because it wants something in there.
Right.
And an implant, when it's accepted by the body, is just like a tooth.
Okay.
Okay?
Can I see what an implant looks like?
You bet. This is
Okay.
an implant. Now, nowadays we have more implant choices forever
Okay.
than ever. And
Okay.
this right here, the tooth root, is the titanium part.
This part right here.
That's correct.
Okay.
And the top is the crown, which is
Right.
the tooth itself that's in the mouth.
It looks just like a regular tooth.
It kind of does.
It does.
Yeah. And that's one of the reasons it works, is because when you mimic nature, you're better off, right?
Right.
Now, it's interesting that we have more choices in implants than ever. So in our practice, our philosophy is we try to take the implant that already fits you and use that to fix your mouth so that we can keep it simple.
Okay.
All right?
What does
Now,
it secure to?
Well, the bone actually grows right into the threads of the implant, and there's a chemical bond between the cells of the bone and the implant surface.
Really?
That's correct. And we call that osseointegration.
Osseointegration.
Osseointegration, that's correct.
Okay.
So what happens is you put these in, the body has a healing response. It heals right around it. And then it's basically like having a post in poured concrete. You hang a fence on it, whatever you want to do. You know?
Really?
So we can use them to attach partials and dentures, and we can use single teeth.
Okay, so I just need a single tooth, right?
This is very similar to what you're going to have.
Okay.
It's a single tooth molar implant.
Molar
okay?
implant.
Now what's interesting is all the way across the spectrum, we have implants for little tiny teeth too.
That's a tiny tooth one?
That's a mini implant.
Wow.
Big difference, right?
Oh, really?
Now the difference between a front human tooth and a back human tooth is as much as the difference between a bicycle tire and a car tire.
Yeah, pretty big difference.
Okay? So it used to be we didn't have as many choices.
Okay.
But by knowing more choices, we can offer to help people without usually changing them.
Oh, wow.
You know, some people require bone grafts, but we treat 75–80% of our patients without bone grafts.
Okay.
And that's good because we have plenty of bone grafts to do. We don't need to create more. So we try to keep it simple. We try to find something that already fits you. And thanks to all these different companies researching different ways of doing it, we have more choices than ever, and we try to keep it as simple as possible.
I like simple, believe me.
So here's some examples of some actual cases that we've done. Okay, now these are duplicates. These haven't been in anybody's mouth.
Right.
But what we're showing is that you need to fill the molar space in with something of similar size.
Right.
And by having more size choices, we can more likely match the size of your tooth to the size of your mouth.
Right.
Okay, and so at the end of the day, the implant, this is the abutment. Remember we said the thing that holds the crown on.
Yes.
And this is the crown. And usually these are cemented. Some of them are screwed onto the implant, but this is a cemented one.
Cemented one.
And it turns out very nice. The gums have been torn away so you can see how that connects to the crown.
Oh, easy. I understand.
Yeah. And that'll be cemented. Doesn't come off.
Now what's this one?
This is one that replaces 2 teeth. Okay? And this is a very modern technique. What it is it's 2 posts put in and splinted together with the crowns.
Oh, so that's just one crown. Oh, I get it.
Yeah, and this is a lot less expensive. And this is called the mini dental implant option.
Mini?
Okay? Mini dental implant option.
Okay.
Very good for when the ridges are slightly narrow, but you don't need very large teeth.
Right.
Okay, because this can be done in 2 visits, and it's a non-invasive procedure. There's no stitches, no bleeding, no bruising.
Right.
Very, very quick and efficient.
But that's not
and
a
very
molar.
lasting.
That's not a molar, is it?
No, these are bicuspids.
Okay.
Right? But this replaced a partial. This person was wearing a partial, and it was damaging their jaw.
Oh, wow.
Okay, and it also tugs on the other teeth, and so this bridge over here was showing strain, and we were getting ready to lose this side.
Oh,
Okay?
wow.
So by getting rid of the partial, even though we only did 2 teeth,
Right.
that was plenty. You know, one of the secrets of this stuff is don't do more than you need, because it's not cheap.
Right.
So this was enough to save her from getting indentures.
Wow, that's great.
Yep.
Okay.
And this is just another single
Example,
molar.
yeah.
Okay. Just a different kind of implant. This is that one-piece implant I was talking about, where if you have good bone, you can place a one-piece implant and you can put your temporary crown on the same day.
Oh, wow.
This is a 3-piece system where the implant was buried because there was a difficulty with the bone, allowed to heal, and then these 2 pieces put on later.
Okay, got it.
So what we do is try to keep it simple. So this is our simplest bridge work option. This is our second simplest, and this is the most complicated, although all 3 of them we accomplish with pretty good ease.
So which one of those is going to be in my mouth?
Well, you're going to most likely have this one right here,
Okay.
okay?
Right.
Because these won't work for you because you need a molar,
Yeah.
all right?
Uh-huh.
So that's out. This is too complicated for your situation. You have good, solid, healed bone of adequate size.
Right.
So we're going to use a one-piece implant
Right.
that's going to go into the site,
Right.
and it's going to be stable from the beginning. It doesn't require bone grafting. We're going to make a mold. We're going to go ahead and put a temporary tooth on that day, and then we'll finish the mold, the permanent tooth. Usually we put that in between 8 and 12 weeks, but you have a tooth the whole time.
Oh, that's good. That's
Yeah,
really
so
important.
You don't have to worry about
I don't
it.
have to worry about it. Now, can you show me some examples of other implants that you've done and other
Absolutely.
procedures?
Absolutely. Let's take this down. Believe it or not, this is all implants.
That's the whole mouth is implants?
The whole front smile.
Front smile is.
Yeah,
Wow.
all implants.
I
okay.
can't even believe it. It doesn't look like it at all, does it?
Lori had an old bridge. Remember we talked about your situation?
Yeah.
The most common baby boomer situations.
Right.
Poor Lori had gotten her front teeth knocked out. Okay. And for many years she wore this bridge, over 20 years.
20 years.
And then
wow.
it started failing, and guess what? When it starts to fail, it drags down the good teeth that it's holding on to. That's the biggest problem.
Is she in
with
a lot of
bridge
pain
work.
then?
Well, one of them, yeah, absolutely. So, but we made that go away real quick, all right?
Okay.
So what we did was, by strengthening her, because if we tried a second bridge, and believe it or not, a lot of people try that. If we tried a second bridge, we either need more teeth, which ruins more teeth, or with implants, we can actually strengthen it to where the front teeth are standing on their own now. They don't lean on the natural teeth.
Okay.
So here's what we did, okay? This is what we're going to put in her mouth, okay? And what we did was we placed these 4 implants up front. Now these are the smaller implants because these are smaller teeth,
Okay.
okay? And because some of the bone was damaged,
Right.
and her lip line is low, we don't have to put a single tooth implant, all 4. That would be over $16,000.
Wow. So what did you do?
Well, we did 2 separate pieces
Right.
on very simple implants, and we did that for about half of what it usually costs.
Wow. That
So-
is really effective.
Yeah, so that's what we're talking about simplified implantology, okay? There's no reason to floss implants. They don't get cavities.
That's true.
So why are we making individual teeth unless we have only one tooth missing?
Okay. Makes
Okay.
sense.
So with that small sacrifice, you can't tell the difference, and this will last the rest of her life. And these are her teeth that used to hold her bridge on. Imagine the strain on those 2 natural teeth.
Wow.
So we put new porcelain on those,
Right.
and then here's what it looks like.
That's
2
what it
teeth
looks like.
here,
Wow.
2 teeth here, 1 tooth back on the natural tooth, and 1 tooth back on the natural tooth.
Wow.
Okay? And then that brings you here. See?
Oh, wow. What a difference.
It's beautiful. And then here's your smile line. See?
That's gorgeous. And she was really happy with that.
Pretty happy.
Pretty happy.
Absolutely. And we did this without surgery, without bone grafting, without stitches, without bleeding, without bruising.
And how often do you see her now?
We see her twice a year.
Wow, that's great.
Because she's got all the rest of her natural teeth. But that's another common baby boomer problem, is the failing front bridge.
Right.
And you don't have to get a partial, and you don't have to get a bone graft all the time.
Where can people get more information, Dr. Butler, since we've run out of time? And we're going to be coming back and doing regular sessions with you all the time.
Right.
Because we want to educate the baby boomers and others
Right.
to really take care of their mouths, because they're going to be a lot healthier and live longer. So where can people get information?
IDISmile.com. IDISmile.com.
Right, and I see that
Which
you have this
we've got
wonderful new logo, which is gorgeous. By the way, let's show that real quick.
Here's our website.
Yeah.
Okay. And there's the new logo.
Right.
And we've got all kinds of information here.
Right.
Okay. And I'd also like to show you this video of one of our happy patients.
Okay.
And you said, what are some other things? Well, this happens to be a full mouth where she didn't want the denture anymore. She used to have a denture, and now she has this.
Okay, well, we'll show that.
Here with Marcia, she had this done 2 years ago. It's all kind of bridge, and it is marvelous. And she's having her checkup today, which was perfect, right?
Yes.
Good. So how do you like this? Except for, the idea of having a denture now really sounds bad to you, doesn't it?
Oh, horrible. I love these, and I get a lot of compliments on them.
Good girl. Well, you're doing a perfect job of taking care of them. And you pretty much eat anything you want, and just like having real teeth back, right?
Oh, yeah. Steaks, everything.
Fantastic. Great. Well, what would you say to the people that are a little bit afraid to get it done?
Yeah. Don't be afraid. Just do it.
Good. Thank you very much. What about the doctors that are considering bringing this technology to their patients?
Bring it. Bring it on.
Great. Thanks so much, Marcia.
You're welcome.
We have a great season. We'll see you in the spring.
Okay.
Well, that's really awesome. I really love it, and I want to thank you so much, and I can't wait to come back
You bet.
and get this done and
We're gonna get it
shout
done.
about it. Okay?
That's right.
Thank you so much, Dr. Butler.
Thanks as always, Kathy.
And we'll be back, and don't forget to go to IDI,
Smile.com.
IDISmile.com, and don't forget to go to bornb464.com, and you can see us also now on our YouTube channel too. Just go to Kathryn Raaker YouTube. So thank you so much for joining us, and we'll see you next time.
Thank you for joining us on Born Before 64 with Kathryn Raaker. For more information on our show, check out our website at www.bornbefore64.com.